All right, so our next speaker is Jenny Fernandez. She's a health coach, and I think health coaches, it's a new field actually, especially in the UK. It has been obviously longer around, in the US. And so she's going to talk to us a little bit about what is health coaching and what we should be doing. Jenny, are you there? Do you want to join us?
I'm here. Hi, Leila.
Hi, Jenny.
Hi, Leila. Hi. Here. Yes, I'm here. Good to see you. Thank you so much for having me on.
Thank you. So let me just say a few words about you. Jenny is a rehabilitation physiotherapist with a master's degree in preventive cardiology. And you have been actually working, over 20 years in NHS, dealing with patients and people with a wide range of conditions. But then you made the switch to health coaching, which I find quite interesting. So do you want to tell, just let's start there. Why did you change your career path?
Okay, so if I can set a little context to the story, I experienced a health revelation of my own in my mid-20s, and that came through exercise, and that's actually what led me to train as a physiotherapist. And I found that I really enjoyed my work, particularly in community rehabilitation, which I specialized in. I enjoyed the personal touch of working with a person in their own home, problem solving with them. It was very different to being in the sterile environment of a hospital. But I always felt that there was something missing, and I wasn't really quite sure what it was. So years later, I came across a health coach, a vegan health coach, and we had a chat, and my interest was really piqued. So I went on to do some more research and looked into, what does it actually mean to be a health coach? And then I decided to train. And I really do feel that having had this training to be a holistic health coach specializing in habit change, I really think that was the piece of the jigsaw that was missing for me. So that's really what propelled me to go forwards.
That's really interesting. It's always there is a story, and I think it actually helps knowing the story, why actually did you make the switch? And it is a new field, isn't it? And, you talk about a holistic health. Do you want just to talk a little bit about that? What do you mean?
So, I think it was mentioned by the previous speaker, so I'm just going to repeat the same thing, really. But it's the 6 pillars of lifestyle medicine that completely encompass holistic health for me. So it's the whole food plant-based diet. We saw the beautiful picture of the Eat Well plate. It's movement and exercise. It's stress management. It's getting good restorative sleep that actually, really replenishes your body and allows you to heal. It's about avoiding the usual suspects, smoking, alcohol, drugs in general. And also, these having meaningful social interactions in your day-to-day life. That's key to, and the beauty of these 6 pillars of lifestyle medicine is they tend to sort of intermingle, and they have knock-on effects one on the other. So it's that for me encompasses it beautifully. I couldn't say any more than that.
Yeah, I agree. And, if you think about it, the first one you mentioned was, a whole food plant-based diet, which is the focus of our talks today. And again, as if people have been listening, that is what we keep saying, whole food, it's really simple: legumes, whole grains, fruits and vegetables. So what about, movement and exercise? Do you want to talk a little bit about each pillar?
Well, I mean, as a physiotherapist, it's and as I said, it was a transformative experience with exercise that led me to train as a physiotherapist. So movement and exercise is key. And actually, there is some interesting work in the world of behavior change, the trans-theoretical model of change by Prochaska and Clementi. It's known as the habit change model. It's very interesting that when they looked at behavior change for different issues, exercise and diet really paired well together. So in other words, when they were looking to help people to improve their health, they could work on those 2 goals simultaneously. They really support each other. Whereas, if someone wanted to give up smoking and they wanted to eat more healthily, those two didn't really pair up so well. So you sort of had to choose one to focus on and then deal with that one and move on to the next one. But health and exercise food and exercise go together. And I just think they are the cornerstone of good health.
I find it actually very interesting you say that, that they go together. And, a lot of people who, I see, for example, and they want to lose weight, there's always this issue, people say, but I exercise every day, I'm not losing weight. And I think, yes, by doing actually physical activity, you can help your weight loss journey, but we exercise for other reasons, just for feeling good. Again, the health benefits, but just, boosting your mood. And once you actually feel better in yourself, you're more likely to eat a healthier diet. It's almost like I have exercise, let me have a better diet, let me choose the better, healthier option, isn't it?
Well, it is. It's almost like I don't want to undo all the hard work that I've done with exercise, because obviously you're improving the function of your heart and lungs, you're strengthening your muscles, you're strengthening your bones, your tendons. You're pushing, when you're exercising, you're pushing all that blood across your body, you're perfusing all your tissues in your body. It's really, I remember being on a course once saying that, if you could put all the benefits of exercise into a pill, that whoever did that would just never have to work again. They'd be a multimillionaire overnight. So, I can't stress more how important exercise is. And you're absolutely right. For the mood, the feel-good factor, you sleep better, all sorts of things, body image, if your body starts to change, you're happier with the reflection that you see in the mirror. That's just a positive. It's an endless list of positives that come out of exercise, really.
Yeah, and you mentioned it earlier that all these 6 pillars you talked about, they actually interlinked, you even now, you mentioned when you exercise, you sleep better. And it's also good for stress management.
Yes, absolutely.
So, it's almost like by doing one, you tap into the next one, and, it just, it feeds off each other. So it's really good. I like that. Now, so again, this is a new field, and a lot of people don't know, why they should actually seek out a health coach. So why do you think health coaching is important?
Well, I think if you look, at the state of health in the UK today, and actually not just in the UK, but across the world, I think we're probably all agreed that we're not in a great place. So, we see rising levels of obesity and diabetes. And very worryingly, we're seeing this trend in children, and in quite young children. And that's actually something that I personally find alarming. And I think all healthcare professionals, would consider this to be alarming. You look at Alzheimer's disease, which again is another disease that's lifestyle mediated. It's destined to be the most expensive healthcare cost in the United States by 2050. And as you know, in the UK, we're only ever 2 or 3 steps behind the United States. So we're on the same trajectory. Cardiovascular disease, stroke, heart disease, the lifestyle mediated cancers, just think of the toll of misery and pain and disability that they cause. And that's despite decades of us throwing millions and millions of pounds at testing and research and developing new drugs, and yet we're still living with these diseases. The list goes on. We've just heard all about autoimmune diseases. We know that there are gastric problems, skin problems. We know that people who have diabetes, hypertension, or are obese, they're at risk of if they contract COVID, of having a more severe disease. So I could go on forever. The list is pretty much endless. And I think that the current medical model of drugs and surgery has its place. It's given humanity some astonishing benefits. So I would never want to say that we don't need them. But I think when you're looking at lifestyle diseases or diseases that are caused by lifestyle, what do we actually mean by that? We're talking about poor habits, unhealthy habits that are the cause of the disease in the first place. There is not a single pill yet in the world that can dissolve an unhealthy habit. There's not a scalpel or a surgeon anywhere who can cut out an unhealthy habit. He or she can cut off your gangrenous diabetic foot, but can't cut out the behavior that led to that in the first place. So I think this is where health coaching steps in. I think it has to run hand in glove with a new medical model. You know, what I have as a health coach is the ability to give a patient space and time to consider, you know, where they are, what the future could look like for them, what the future will be if they continue in the current trajectory, and to help them overcome all those obstacles and barriers to making these choices, these changes. And, you know, there are some people who might have a short consultation with their GP, a little bit of advice, and, you know, they pick that up and they run with it. But lots of people don't. Lots of people really struggle because daily life gets in the way. They're under pressure. They've got things to do. They need that extra support. And I do think the day will come when we have a health coach in every GP surgery. In fact, probably more than one health coach in every GP surgery, because, you know, the tide of chronic diseases doesn't show any sign of abating at the moment.
Yeah,
So
I agree. And I think you would, you know, it would be so great to have a health coach, you know, with every, you know, every, you know, GP surgery, because, and I think it is about, you know, if we do something once a week, that is not a habit. A habit is something we do every single day, and it really builds up. You know, maybe let's talk about food, like, you know, an ice cream every week, that's not gonna really make you put on weight or cause any other major health issues. But if you have it every single day, then it does, you know, create problems. And I think a lot of times we are not even aware of it, you know, and that's why we need the help of somebody. We just need help. Let's put it that way. We really need help, somebody to guide us and make those changes. So what is the most common problem, you know, people come to see you with?
Yeah, that's a really good question. You know, I think people often come and see a health coach because they're actually not quite sure what's wrong. So, you know, they have this feeling that something needs to change, and they will say something like, I want to feel better. I want to have more energy. I want to be able to do things. I want to eat better. I want to have, I want to improve my lifestyle. So these are all things that are quite they're quite non-specific. It's you know, very different. You will go to the doctor and say, well, look, I've got this pain here, or whatever it is. It's you know, it's more targeted. So you know, my job as a coach is to really dig deep and find out, well, what does feel better actually mean? You know, what's not feeling good at the moment? What is feeling better? What's the vision that that person has? And, you know, that's quite that's quite a process. That's quite a lot of work that sometimes has to happen to really dig down, really find out what's motivating the person, really let them dream a little bit about what the future could look like. It's about opening possibilities up for them. It's about finding what's really important to them. So, you know, for example, I remember a gentleman who had been to his doctor, and the doctor had said, you need to do something about your blood pressure and your cholesterol because they're high. So, you know, I saw this gentleman and he told me that, and I asked him, well, how important is that to you from a scale of 0 to 10? You know, where 0 is it's not important at all, and 10 is it's the most important thing in my life. And he said, well, it's a 4 because the doctor's given me pills and I intend to take them. So, yeah, it's a 4 out of 10. Well, a 4 out of 10 is not a really good score to be able to start implementing habit change. So I had to dig deeper with this gentleman and ask him, well, you know, what really matters to you? What is it that you want to do that you can't do? And he thought for a bit and he said, do you know what? I want to be able to kick a football in the park with my grandchildren at the weekends. That's what I really want to do. I want my grandchildren to remember me as a grandfather who was fun, not some grumpy old man who was stuck in an armchair all the time. And he said, I just can't do it. I'm carrying too much weight. My joints ache. I get breathless. I never have enough energy to do anything. And, that's really upsetting. So I thanked him for sharing that story. And this is what I mean about digging deeper. That's when you get those stories from people. And I asked him to score that from 0 to 10. Well, what do you think the score was, Leila?
What was it? 6?
It was a 9 or a 10.
Wow, that's amazing.
Yeah, exactly. But that's the hook, you see. That's the hook. So as a coach, I have to explore. I then provide support and guidance. But most importantly, I also provide accountability. So I can hold up that mirror to that gentleman. Whenever he's flagging, I can say, well, what about kicking the football in the park with the grandchildren? That's so we make sure that we go on the right path. And the other beautiful thing about the whole process is the changes that he had to make in order to play football with his grandchildren were exactly the same steps that brought down his blood pressure and his cholesterol. But, if we'd focused on the blood pressure and the cholesterol, we wouldn't have got the results. But because we focused on what really meant something to him, on the emotional side, on the things that were important to him in life, we had good results.
Yeah.
So the coaching.
Go on, sorry.
No, go on.
I think focusing on numbers can actually be frustrating. If you're chasing numbers, my cholesterol was this, now I need to bring it down. And, it adds to frustration. And obviously, you don't want to kind of be feeling frustrated and stressed. It's not going to help you change your habits, isn't it?
Yeah, absolutely. I mean, there are some people who will be motivated by the numbers, and then that's fine because you focus on the numbers. But I think generally, most times people they're more concerned about the things that are meaningful in their life and the things that bring them joy, the things that bring them love. Those are the things that really motivate them to change.
Yes. And I think, again, it is a lot of us, actually, a lot of people have forgotten what health means. Being healthy. I mean, the society, the information we get, from the media, it has kind of normalized being unhealthy, being unfit. So people don't actually dare to dream. This gentleman you just told us about, he actually didn't dare to believe that it is possible for him to be that healthy so that he can kick a ball with his grandchildren. So I think, again, we just need people to help us to dream, as corny as it sounds. That is what we need, isn't it?
It is. It's completely. That's exactly what it is. And yes, you're right. It does sound corny. No one goes to their doctor saying, "Doctor, help me dream." But if you don't dream, you won't start to explore the possibilities that are out there for you to take. You'll just remain stuck. There's a saying, isn't there? If you always do what you've always done, you'll always get what you've always got. But dreaming does allow you to sort of expand and to move out and to try something different, expand your horizons.
Expand, and have a vision, a better vision, something better for the future. Now, we talked about, changing habits, and which is actually probably the cornerstone of actually changing your lifestyle. If you want to change your lifestyle, you need to change the habits which make up that lifestyle. So how do we do that? Any tips?
Well, yeah, I mean, habits are fascinating. We need habits because a large percentage or a considerable percentage of everything we do every day is based on habits. And this just frees up computational space in the brain to allow you to think of something else. So I like to think of habits as a record, a song. So the record is recorded with all its unique grooves and troughs in the record, and that's imprinted in the brain. It's essentially, it's a scheme of behaviors. It's a blueprint. It's a map of a certain set of behaviors. And a habit, in order for that record to play, the habit has to be triggered. So a really easy example is brushing your teeth before you go to bed. The trigger is, I'm going to bed. So that triggers the behavior to go into the bathroom, brush your teeth. You don't even have to think about it. You just do it automatically. And then there's a reward. The reward is, you know, in the teeth cleaning thing, oh, I've got nice, fresh, minty breath and my teeth are clean. So habits, once they're established, they're always there. That record is always recorded somewhere in the brain. But that doesn't mean that we are destined to live, you know, that we're predestined to live through this automated behavior, you know, that we're going to sing the same song forever. You know, through the beauty of neuroplasticity, the brain has the ability to learn and to form new connections and to record a different song. So when you want to record a different song, you know, it might be, I want to eat fruit for breakfast every day. That's your new song. There's an element. You set up the trigger, you have the element of practice and repetition, and you have the reward. And where the health coach really steps in with this is there are 4 things that have to happen for that habit to become cemented and to become part of what that person does every day. You have to start easy. I mean, the previous speaker spoke about this as well. You really do have to start by making things easy so that they're attainable and the person can experience success. Can you imagine if you set a goal and you keep trying and trying and trying and you just undershoot the goal? How frustrating would that be? You would soon give up because, you know, you just run out of motivation. And motivation is not a good thing to rely on anyway because it fluctuates. So it's about making it easy. It's about allowing the person to experience success and then really importantly, celebrating that success. There's evidence that's coming out about changing habits. And I found this quite surprising, but the element of celebrating the success is actually more important than how many times you repeat the process. So I thought that was really interesting. And I think sometimes we're not very good at celebrating our successes, myself included. You know, I find that quite difficult, but I've learned how to do it. There are ways of doing it which seem very alien when you first start practicing, but then, you know, they become more natural. And then the 4th thing is that the process needs to be fun. No one is going to want to do something that's a drudge, that's, you know, it's a bit like, you know, at work, it's like, oh, no, it's time for the monthly spreadsheet again. We don't want that kind of mentality. We want people to be enthused by what they're doing, you know, happy to feel that sense of accomplishment. And that's what happens. It's the emotions again. It's the emotions that will cement that into the brain.
Yes, it is part of the neuroplasticity, isn't it? That, you know, when you're creating, I don't like to say habit because when each time we say habit, people assume automatically that it is a bad thing. But as you mentioned, some habits are actually good. And in fact, when you create new habits, you want those new actions to you know, turn into habits so that you don't have to think about them, you know, all the time. You know, you just do it automatically instead of having, I don't know, that chocolate in the afternoon, you grab the banana. So you want them actually to turn into habits. And I think, as you say, you need to enjoy it. If you don't enjoy it, you're not going to stick to it. You know, it's not going to last. Now, obviously, it's a plant-powered expo. So we have people who are already vegan and some people who might consider going vegan or, you know, just give it a try. So do you have any, you know, tips for, let's say, 3 top tips for new vegans?
Yeah. I mean, first of all, let me celebrate our new vegans. You know, it's fantastic. You've done something amazing for your health and for the planet, for the animals. It's an incredible choice that you've decided to make. So I think what I would say, if you're a new vegan, please don't be hard on yourself and don't expect perfection. You know, you're embarking on a journey of discovery. That's what veganism is. You learn something all the time. And you know, if you mess up one day, you're only human. Every single one of us who is vegan, we have messed up along the way. And, you know, we probably, you know, it's not beyond the realms of possibility that we will mess up at some point. So don't give yourself a hard time and actually celebrate that success. It's so important that veganism becomes a joyful part of your life, because, as you know, everything that I've just said about how you create new habits, this is a new song. Sing that song with joy so that it becomes, you know, your default mechanism. You'll find over time the choices, where you start off and you're, reading labels all the time in the supermarket and looking, what does this mean? What does that mean on your phone? You'll assimilate all of that with time, and it will just become automatic, and you'll just automatically make the choices that align with your values and allow you to live the life that you want to live. So please celebrate and don't be hard on yourself. I think tip number 2, I'd like to talk about the meat substitutes. So, the plant meat substitutes are great products to get you started. They allow you to just recreate a dish that you've always loved without having to think too hard. Habit change, make it easy. These products make it easy for you to become vegan. However, what I would say is, I'm advocating for health, and I know beyond a shadow of a doubt, because I've felt it in my own body, and because, as we know, there is just a stack of research to support it. A whole food plant-based diet is the one that's going to give you long-lasting health. That's not to say that you're never going to get sick, but you're stacking the odds in your favor to be healthy for the rest of your life. So what I would say, use those meat substitutes in the beginning to get you started. They're also really useful if you're going out to dinner with friends and you don't go to a vegan restaurant. Most places do have, some sort of substitute that you can order. So it means, it doesn't mean that you have to be a hermit. You can still see your friends. They're useful as well if you want to invite people home. You want to cook for them, you can use the meat substitutes. But let's take a dish like spaghetti bolognese. You would have started off before you were vegan using a meat mince. Now you've gone vegan and you're using a vegan mince. Well, take that the next step along and make the spaghetti bolognese in exactly the same way. But instead of adding a vegan mince, you're going to add a tin of lentils, or you're going to crumble some tempeh. Use the same herbs, use the same spices, enjoy the meal in exactly the same way. But I would urge you to just try and do that. You can make simple swaps, brown rice instead of white rice, wholemeal bread instead of white bread, wholemeal pasta instead of white pasta. These little things that you can add into your journey as you go along. So I think that would be crucial. And then we said 3 tips, didn't we?
Yes,
okay.
That's fine. You can just, I love those 2 anyway. And I also want to ask you, for a tip for those who are already vegan, just go with that now. Let's, for people who are listening and they are already vegan, because as, from the previous talks, we know, eliminating animal products from our diets is good and healthy. So what is the next step? What is a tip for those who are already following a vegan diet?
So people who are vegan and want to be healthier, again, if you're not on the whole food plant-based journey, just get onto it. You know what the products are. They're whole foods, whole grains, beans, legumes, the soya products, tofu, tempeh, fresh fruit and vegetables, nuts and seeds, and fermented foods. Start to introduce these foods if you're not already eating them, and aim to reach 95% of the time. So that still leaves you 5% of the time that you can enjoy your, vegan junk food, whatever that is. And make sure that you, and new vegans as well, make sure that you get your nutrition advice from a really reputable source. So it's very tempting to follow, a YouTuber or a blogger or somebody on Instagram. But, my suggestion would be that you go to someone like the Vegan Society, or you go to Plant-Based Health Professionals UK, because they have absolutely incredible resources, including some fantastic fact sheets for different conditions and different things. And there's lots and lots of research there if you want to look at the evidence yourself, which, I would urge you to do if that's what you want to do. So I think that's what I would say to existing vegans. Make that switch if you haven't made it already. And secondly, if you're not doing this, I would suggest that you adopt a stress management technique into your daily routine. And now that can be anything. You could dance to your favorite song, you could go for a jog, you might want to journal at night before you go to bed and just jot down in a book, things that are on your mind or what's happened during the day. You might want to pick up a meditation practice. I mean, all these things, they're evidence-based as well, walking in nature. But what I would say is make that a habit so that you do it 5 minutes every day, 5-10 minutes every day. That's going to be far more beneficial to you than doing a 2-hour blast once a month. So try and think a little bit about, well, what time of day would be best for me? So let's take the example of a meditation practice. You might like to do it in the morning when you get up. So that's a question of just setting your alarm 10 minutes earlier and making that a habit. Use an app. There's a really good app called Medito, Medito. It's free. Headspace is another good app, but you have to pay for that, and then you just do that every day and build it into your life and kind of treat it as, this is my time for me. This is my time to let go. This is my time to not worry about everything that I have to do. And then it really has value and it becomes, a method for you to manage stress in your life. So those would be my suggestions.
Yeah, I think stress management is so important. I mean, we stress it, So actually, it's almost like what we were discussing earlier about the 6 pillars, and it is part of it. And I think it should really be addressed, especially with everything that is going on at the moment, isn't it? It is. We need it. Our lives are so busy. We need to have a practice. Again, something like you said, which we do every day, not just once in a blue moon. So we need to have a practice. I really love that. And I also loved what you said. That is something I always mention in my talks as well. If you want to get your information about a vegan plant-based diet, get it from a trustworthy source. Vegan Society, Plant-Based Health Professionals UK. I mean, nowadays there are so many bloggers, which is good. I mean, they are trying to spread the message, but they don't have the qualifications necessarily. And so, by all means, if you read an article, just check the qualifications, see if, what they are talking about is based on science. Otherwise, Vegan Society and Plant-Based Health Professionals UK. And obviously, I'm biased because I'm from Plant-Based Health Professionals UK.
Of course.
Anyway, let's move on. Just one question. Imagine somebody's listening to you and they are really, inspired by what you are saying, and they think, oh gosh, my brother, my sister, or my mother could actually really use a health coach. Could they actually book an appointment for them?
Okay, so first of all, I only see adults, so I wouldn't see anybody under the age of 18. And secondly, I think what's important to understand that, health coaching is a process and it does go deep. So the person who's receiving the health coaching has to want to engage in this process and has to want to make change. So if you're thinking, yeah, I'd love this for my mum, by all means, go and have a conversation with your mum, and explain what you've heard today, what you've learned. And then what your mum can do is book a free 10-minute inquiry call with me through plantbasedhealthonline.com. So that would be my suggestion.
Yes, I think it is important for people who want actually to change their life to kind of take that first step, isn't it? And that first step is actually, taking the phone and making that phone call. So yes, I totally agree. And you already mentioned that. So where can people find you? You mentioned plantbasedhealthonline.com. Where else?
Yes, on Facebook, I'm also on Plant-Based Health Online, and on Instagram, I am Jenny Fernandez _coach.
That is lovely. Let's have a look at some of the questions people have written. Linda Curtis, yes, health coaches are needed more than ever. I agree, obviously we agree. And Janet is asking, there are a lot of courses out there. What qualifications, do you need any prior qualifications before you do a course?
So I think that could depend from course to course, but what I would definitely do is look for something supported by ICF, the International Coach Federation. I trained with a company who were accredited with the ICF, so that does give you some standard. And there is the UK Health Coaching Association, so you can look there and you can get some more information about accredited courses. The course that I did was a 6-month course, but you had up to a year in which to complete it, because I know there are coaching courses that are weekend courses that are out there, but you know, there's a lot to learn. And the other thing I would recommend is that you look for a course that gives you plenty of opportunities to practice, because it's one thing to learn the theory, but you really do need to practice and get used to having the sort of coaching conversations and asking, you know, open questions, and not feeling embarrassed to delve a bit deeper, because sometimes you might feel that you're crossing a line, but actually it is your job to delve deeper, obviously sensitively, but that's what you need to do. So yeah, look up those associations.
Thank you, Jenny. And Jane has written that she's thanking, she's saying it's very inspiring and motivational. She's drinking water and walking more. Well done.
Yeah.
And she wants to implement more healthy vegan foods. You know, you could actually have a look at the website of Plant-Based Health Professionals UK. We have a few recipes, not a lot, but they are healthy. And also, if you haven't, you can sign up to the 21-day Plant-Based Health Challenge. Again, you can find the link on the Plant-Based Health Professionals UK website. And you know, even if you don't follow all the emails, I think it is the second or third email has an ebook with recipes, so you can get a lot of nice new recipes to try. So I shouldn't really say that. You should actually obviously get all the emails and not unsubscribe. But you know, there is a nice ebook attached to it, so I would really recommend it. And that's it. Thank you very much. Any other questions? No, I think that's it. It was really lovely talking to you, Jenny.
You too, Leila.